So let's talk about your bariatric multivitamin supplements. It's really important that you start these supplements 1 week after your surgery. You may be able to obtain your supplements from the facility that you had your bariatric surgery with, or you may be able to order these online. But I want to let you know what to look for in your supplements. Number one, your multivitamin supplements should be designed for those who have had bariatric surgery. That means they meet ASMBS guidelines. The American Society of Metabolic and Bariatric Surgery has set certain guidelines for patients who have had bariatric surgery when it comes to multivitamin and nutrient intake. You want to make sure that the marketing or the label on your bariatric multivitamin states that it meets ASMBS guidelines. Secondly, there are a variety of multivitamin supplements out there. Be sure that you take them as recommended. There are soft, chewy multivitamins, there's hard, chewable multivitamin tablets, there's vitamin capsules that you can swallow. Any of these are fine if you're taking them as directed. Again, you want to make sure that you speak to your bariatric facility program director or your registered dietitian to see what they recommend. Bariatric multivitamins differ from each other mainly in their mineral content. Some bariatric multivitamins contain iron while others do not. If you have a history of anemia and you're not taking iron, you might want to consider taking a bariatric multivitamin that has iron in it. If you're not worried about iron, and if it's never been an issue, if you know your stomach is sensitive to iron, it makes you nauseous, maybe you want to start with a bariatric vitamin without iron and wait and see if you need it later down the road. You may find out that you end up, needing some extra iron to add in on the side, and that's fine. There's no problem with that. But know that your bariatric multivitamin may or may not have iron. So a multivitamin is one thing, but then calcium supplements are also needed after bariatric surgery. The whole thing about calcium is your calcium absorption changes after you've had your surgery because you're not making as much digestive enzymes. The environment in your gastrointestinal tract is less acidic. Calcium needs an acidic environment to be absorbed. Therefore, the most bioavailable calcium supplement out there is calcium citrate. All bariatric patients should be on calcium citrate after their surgery. Now, the guidelines for that are at least 1,200 to 1,500 milligrams daily. So do the best you can to get as close to those numbers as you can. You must know that you can only absorb about 500 milligrams of calcium citrate at a time, so you only want to take a 500 milligram dose every 4 hours. You want to take your multivitamins as recommended, and you want to take your calcium supplements throughout the day at least 4 hours apart from each other. One other thing to keep in mind, calcium and iron compete for absorption. So if you're taking a multivitamin that has iron in it, and you also have your calcium, you do need to make sure that at least there's a 2-hour window between those two. So for example, if you took a multivitamin with iron at 10, you want to wait until at least noon to take your calcium supplement, because the iron and the calcium will compete for absorption and you won't be able to absorb both of those at the same time. Keep that in mind. You also want to make sure that you start B12 supplementation at least 6 weeks after surgery. Your options there are to do a B12 injection at least once a month, or take a daily sublingual B12 tablet under the tongue on a regular basis. Your facility may provide B12 injections. You may be able to get that from your primary care physician. But if not, don't worry, B12 is very easy to find. You can find sublingual tablets from any grocery store or drugstore. Just make sure that it's sublingual, make sure that it dissolves under your tongue, and take it each day. It doesn't matter when you take it, and you don't have to keep it separate from anything. Bariatric multivitamin supplement with or without iron, calcium citrate at least 3 times a day, and a vitamin B12 beginning no later than 6 weeks after surgery. Those are the most critical supplements that you will need during your first year. It's very, very critical that you take these. If you don't take your multivitamin supplements, you can run into some complications with nutritional deficiencies. Now, your bariatric program should be running routine lab works to make sure that this doesn't happen. You should be getting labs drawn at 6 months after surgery and then again at 1 year after surgery, and then most facilities do an annual set of nutrition labs. This is not a regular CMP. This is a very detailed set of labs that indicates whether your nutrition is adequate or not. So make sure that you get your lab work done to see that those supplements are working, but you have to take your supplements. You don't want to not take them and then get labs drawn and everything's low. It's very, very important. And if you're not tolerating them, it's important to communicate that to your bariatric facility so that they can help you find the right supplement. If not, if you don't have a program that you're working with, again, you can use products like Bariatric Advantage or Bariatric Fusion. These are two very credible companies. These supplements have been tested on bariatric patients and are very much appropriate for you after the gastric sleeve bypass or even the lap band. So you can visit our website and you'll be able to order these things online as well. That's what you need to know about your multivitamin supplements. Hang in there, don't stop taking them, and get your labs done. Good luck, everybody.